Good morning, I'm Patty Post. Today we're going to have an in-service of the bladder scan. This is a BVI 9400. You are used to a BVI 3000. Same manufacturer, just some different bells and whistles on this machine. The first thing that you do is turn on the machine with the universal power button here. Spa music to get your patient relaxed and in the supine position. In the front here, you are going to see a battery life indicator. And right now it's full, so it's completely blue. But if you turn on the machine and it has just a quarter or just a little sliver of blue in there, that means that the life is almost over, and just turn off the machine and pull out the battery. Your extra battery is going to be in your storage room, and it lasts about 2 weeks. Each battery does, so you never have to plug it in. Just simply go find the new battery if you need it.
Show us on the screen again what it how it looks like.
Sure. So we're turning it on again, and just wait a minute while it turns on. Of course, it's really slow now that we're taping. There we go. Here's that spa music, and it's just on the left-hand side of the screen. And it actually has numbers below of how many minutes are left in the battery. So it will go down to as low as 30 seconds. First thing you're going to do is tell the scanner if your patient has a uterus or does not have a uterus. And how you do that is by clicking this first button, and you're going to toggle between uterus is present, and that's the female wearing the dress, or uterus is not present, and that's male or your female that has undergone a hysterectomy. Now your probe is different in this scanner versus your other probes. It's a trigger probe. It's just press and release to activate the picture. You're really taking a picture of the bladder. So you're never going to be moving the probe around, and it's only a 3-second scan. So once we're ready to scan, in your health stream video you saw that your scanner needs to be in your left hand, and the patient's head needs to be to the left and the feet are to the right. The reason for that is you want your scanner and your probe to mirror up with the arrows, and I'll show you that in a second. Now here's my patient's head's to the left, feet are to the right. Patient's pubic bone is here, and I'm going to place my gel, and it's going to be a nice dollop of gel here. And the reason for that is I'm going to place the gel, place the probe just up and down, and I want the gel to be hitting this white case, so there's no room or there's enough room for all of the gel to completely cover the probe. And I'm just up and down, and I press and release. And I can feel the picture being taken on the handle here. And I have 8 arrows flashing, and I have the bladder and the crosshairs. So you can move on from here. But there's a couple of ways to get a false positive. The first way is if you're not following the proper procedure. So I have place my gel, place my probe, press my trigger, the 3 Ps. And then lastly, I listen for that chime. So if I press my trigger and then place the probe, I'm actually scanning the air for a couple of seconds. So I still get a reading of 8 arrows flashing, bladder, and the crosshairs. Or if I press the trigger and then I remove it before that chime, that's again a way to get a false positive. And then the last way is if you're actually moving the probe around while you're scanning. I see that every once in a while that gets a fetal ultrasound, and because you're taking a picture like you do if you had a dog or a kid that was moving around, it'd be a blurry picture, right? So try to keep it still as possible. A jagged bladder will be pictured here if it is if you are moving too much. And now I'm going to show you lastly how to get the bad reading and what I mean with the arrows. So I scan here, and I have an arrow pointing north, and then here on my probe I have the arrow pointing to the right, and it's flashing. So they're both pointing the same direction because I have the monitor in my left hand. Now here I was, all I'm going to do is significantly tilt my probe back towards the way that it's pointing me to. I'm not going to move it like this. If it's a solid arrow, it's just a slight tilt. A flashing arrow means a significant tilt. Sometimes I see it going around like this, and if you do that, you're going to see the bladder move in the crosshairs here. And lastly, to head back home, you can press this arrow here, and then you're back home. Any questions? Oh, actually, lastly, you're going to Clean the probe off with a tissue, if you wouldn't mind getting me a tissue there, and then a sani wipe that will wipe all the way down the probe, and then the cord, and then the front of the screen. And then you're all done.
So we do need the big blob.
You need the big blob, that's for sure. If you ever get a reading of 0, if you have a patient that has a great deal of tissue, and you get a reading of 0, and you know that they have urine in their bladder, I would add more gel and then press more firmly and really push the adipose tissue back. Because at 12-inch scan range, you know that sometimes there's more tissue than 12 inches.
Mm-hmm.
There's no scan button like there was on the last one?
Nope, it's just on the
trigger.
Yep, on the trigger this time. And you can keep holding the trigger if you prefer that. It will stop. Any other questions? We're good? All right, now you can go scan some bladders. Okay, amount of gel that needs to be used. So then the entire probe is covered with ultrasound gel.